Unless you're totally colorblind, you've noticed all the pink around this month. It is Breast Health Awareness Month, and in that spirit, there's a screening and prevention and seminar happening this coming Monday in Nashua at Dartmouth-Hitchcock. Dr. Daniel Abbas joins us live this morning. Good morning, Doctor.
Good morning. How are you doing today?
We're doing quite well, sir. How are you?
Very well, thank you.
All right, so tell us a little bit about what goes on during this month, first of all, and why it's so important.
Well, every year we welcome in October and the opportunity to make patients and the public in general aware of the presence that breast cancer has in our society. It's one of the most highly advertised, if you will, and publicized cancer that people have to deal with. And I deal with patients every day, and to some extent it almost seems it can be quite overwhelming, especially at this time of year. Like you said, pink is everywhere, on billboards, it's on the TV, it's on the radio, it's all over advertisements. And people are to some extent, becoming almost scared. And we had the opportunity this coming Monday night at Dartmouth and Nashua to have a little bit of an educational dialogue with the public and explain what's out there and what can be done to pick up breast cancers early.
So tell us a little bit about what the agenda is for this education night.
Sure. Well, first of all, we're going to talk about risk factors. It'll be surprising to some people that risk factors, some of them are modifiable. People can control some of their risks for developing breast cancer. We're going to debunk many myths. There's tons of misinformation out there that people are bombarded with regards to breast cancer. And it'll be an interactive dialogue. Also, we're going to talk somewhat about advances in technology. 2013 has really welcomed in a great advance in mammography. A new technology called three-dimensional tomosynthesis, or three-dimensional mammography, has really made it mainstream. And it's really hit most of the state of New Hampshire. Dartmouth-Hitchcock in particular was part of the FDA studies that led to the approval of that technology. So we're going to talk about who 3D mammography is good for, what it does, how is it different than traditional mammography, and when should it be applied.
You mentioned a couple of myths. Could you talk about maybe one or two of the most the biggest myths out there that people believe and isn't true?
Sure. I hear it every day from patients. Well, I'm not probably going to get breast cancer because I don't have any family history of it. Family history is a big factor in developing breast cancer. However, the vast majority of breast cancers that are picked up day to day are in women with no family history. They're spontaneous cancers. So the vast majority of breast cancers we see are in women who have no family history. So that's a major myth. Just because you don't have a family history does not mean you're really less likely to get it. We're going to talk about what we do with our high-risk patients versus our average-risk patients. Also, we're going to talk about some modifiable risk factors such as diet, exercise, weight reduction, stuff like that, how that can really reduce the risk of breast cancer in our population.
And I know, obviously, this is probably classified as a woman's disease, but there are men who get breast cancer. Can you touch a little bit upon that?
Exactly. Everybody thinks breast cancer is strictly a woman's disease. That's not necessarily the case. About 2,200 breast cancers are diagnosed in men this year alone. 1 in 8 women will get it. So definitely women are affected much more with breast cancer. However, men do get it. We'll also talk about how premenopausal women, let's say under the age of 50, they're diagnosed with breast cancer, and it tends to be somewhat more aggressive than postmenopausal women. There's been talk in the literature about the Angelina Jolie approach to breast cancer risk reduction with mastectomies. We can discuss that as well. And also, how often should screening mammography be done? A few years ago, there was a big U.S. Preventative Task Force recommendation that changed when and how often breast screening mammography should be performed, and we'll discuss when and who should have it.
There's just so many reports and surveys that come out that you should get it at 30, you should get it at 35, 40, 45. It gets so confusing that sometimes you don't know what to do.
Women are bombarded with misinformation, exactly. Our community practice here in the Nashua area subscribes to having baseline mammography at age 40 for average-risk women, and then every year thereafter. Some women who are high-risk should have it earlier, and then some women maybe who are very low-risk should have it starting at age 50. And we can discuss all those different options.
All right, and I've always maintained that the doctors go to school for so many years just to learn how to pronounce all this stuff. The name of that 3D process again that you mentioned?
Sure, it's technically called tomosynthesis, but the popular media refers to it as three-dimensional mammography.
All right, and what makes that so important these days?
It actually allows us to see through dense breast tissue in small incremental levels. Traditional two-dimensional mammography was prone to a lot of overreads because tissue was overlying one another. With this new technology, we're able to see through different levels of the breast in small increments, and that really reduces the risk of false alarms and unnecessary callbacks.
All right. So how do we sign up for this education night on Monday?
Sure, very easily. Patients and the public in general, and also I encourage men and women to attend, can go to Dartmouth-Hitchcock.org. There's a link there under classes and events to register. There'll be food served, good discussion, and we'll also have the opportunity for them to take a tour of the facility. It'll be a very unobtrusive environment so people can feel comfortable exploring the possibility of having a mammography exam in the future.
All right, Dartmouth-Hitchcock.org, Dartmouth with a dash in the middle, Hitchcock.org to sign up. And are you near capacity for this event yet?
We still have some seats available, and we can always expand if we need to. We're willing to take as many people who are interested to learn, empower the public.
All right, Monday night, 6 p.m. at Dartmouth-Hitchcock in Nashua, Dartmouth-Hitchcock.org if you want to sign up. Dr. Abbas, thank you very much.
Thank you. It was my pleasure. I appreciate the opportunity.